Well, these days we're hearing more and more about healthcare providers looking ahead to a future, one that includes a more diverse workforce within their industry. Just last month, the United Health Foundation announced it was committing $100 million over a decade to further advance a diverse health workforce. That money will be used to give thousands of scholarships to help those in underrepresented groups train for future healthcare work. Healthcare leaders across the region fully recognize this need for equity in our hospitals and in our clinics. They say it's another big step towards addressing the persistent gaps throughout our community. Carla Holt talked with a Hennepin healthcare leader who says their system not only sees the need, they're going to do something this weekend to specifically address it.
Whether reviewing recent history or current reality, Minnesotans know we're at the epicenter of racial reckoning.
It's not a story that we're proud of.
But within challenges and healthcare disparities seen in diabetes to dementia, heart disease to premature births, one healthcare leader sees opportunity for change.
We want to solve that gap. We want to be a part of the many different systems that are here in Minnesota to be able to address that.
As Vice President of People and Culture at Hennepin Healthcare, Dr. Tanya Jackman Hampton says population shifts alone speak to the need for staffing changes. With census data showing nearly a quarter of our state and a third of Hennepin County identifying as something other than white alone. And while Jackman Hampton says Hennepin Healthcare staff of 7,000 is already comprised of 34% people of color, she knows they need to do more.
We are holding a career fair for people of color.
This weekend, a chance for people of all colors to walk in and learn more about the healthcare field, with even the hope of landing one of 700 open positions.
It's really an opportunity for us to connect with the community and ensure that we're creating a pipeline for people who want to come work in healthcare and they hadn't thought about it before. From the recruiters, they'll get background information about the position. From the hiring manager, they'll get an opportunity to interface and ask more detailed questions and actually be interviewed on the spot.
A chance to ensure their staff looks like the greater community.
It was something bold we wanted to do.
Knowing diversity within their ranks directly relates to quality of care and life for everyone.
What does this mean for a patient of color to be able to walk into a clinic, even walk into the ER, and see someone who simply looks like them? What kind of message does that send?
It's a relatable message. We as humans, we connect. So when we see someone who has similarities like us, we tend to be able to build trust quicker. This is work that is heart work and incredibly important, one by one, to save and help people in Minnesota, because the disparities, it's not okay. It's not.
Yes. Dr. Jackman Hampton says a diverse staff just simply increases cultural awareness as staff share information with each other. By the way, that career fair will be this Saturday, and there's going to be a full spectrum of jobs, from nurses to mental health care workers to lab technicians. The event is at Hennepin Healthcare's Clinic and Specialty Center in Minneapolis. We have information about that on our website if you're interested, KARE11.com.